atlas, you can see that the walls are covered with periosteum on either side, and this periosteum it's continuous around the muscles, and this fascia this is continuous around the eyeball also. So this facial layer that is outside the eye, that is outside the sclera, keep it separate from the sclera, because sclera is also known as the fibrous coat of the eyeball. This facial layer that is extending back to the dura mater around the eye, around the optic nerve, this fascia is known as facial sheath of the eyeball, or the other name is Tenon's capsule. This is known as Tenon's capsule. This becomes very important when you are talking to the ophthalmologist, because between the Tenon's capsule and the sclera there is a presence of this space, the episcleral space. And in this space there is a very loose connective tissue and some blood vessels running inside. Sometimes some drugs are administered in this space also as a treatment purpose. So this is the space, the episcleral space between the Tenon's capsule outside and the sclera inside. This space it's continued with the fascia around them, the muscles around them, the fascia of the muscles around them continued back with the sheaths covering the optic nerve, and on the side it becomes continuous with the periosteum. As we can see from here, this point and this point, the facial sheaths they become thick and triangular as they get attached from the muscles to the wall of the orbit. These are known as check ligaments. These are known as check ligaments. Why they are called check ligaments? Because you can see, if this person, this is the right eye, if this person tries to look left, the eye will move, and this muscle, this lateral rectus muscle will stretch. This point will come here, and this ligament will get taut. It will prevent the eye from going too far medially, too far to the left side. So it has checked its movements. And same will be true for the check ligament on the opposite side. This fascia, this Tenon's capsule or orbital fascia, it is especially thick on the undersurface. It is shown in this picture of the snail. Because it is very thick on the undersurface, it is actually hanging the eye, it is actually holding the eye as hammock. Hammock is the bed made up of fiber, made up of a piece of cloth hanging between the two trees. This is the hammock. In Urdu, in our culture, we have a bed hanging of the child hanging under our beds with a cloth that is known as pangoda in our language. So it's like that. It is the pangoda. It is the hammock that suspends the eye. And it is so important in sustaining the weight of the eye. It is the one that keeps the eyeball in its normal place. The eyeball it's not here due to the inferior wall of the orbit. It is there due to the suspensory ligament of Lockwood. And this is made more prominent by the fact that if due to some chronic infection or due to some pathology or due to some tumors, a delicate surgery is done sometimes to remove the walls of the maxilla. If we surgically remove the infraorbital wall or the roof of the maxilla and we don't touch anything else, then the eyeball does not fall. The eyeball remain in its normal position even with the inferior wall of the orbit removed. So this emphasizes the role of the suspensory ligament of Lockwood. Let's talk about the muscles of the orbit. Muscles of the orbit can be divided into two parts: the extraocular and intraocular. Ocular. It is so simple by the name that all